There are many, many imaging facilities in Louisville and the surrounding area. So the question is, what imaging facility will you end up going to?
One thing that I don't think patients understand is their decision to decide where they're going to have their imaging is their decision. There is no requirement to go to any one specific imaging location. Patients can make that choice on their own.
I think that too many times patients feel that if Dr. Smith says you need to go downtown to hospital Y, that's where they have to go. And that's really not the case at all.
So when a patient sees their doctor and their doctor determines that they need a CAT scan or an MRI or an imaging procedure, what patients need to understand is that it's their choice and their decision as to where they get that procedure done.
Now, many physicians have their preferences based on years of relationship with a particular radiologist or a particular hospital or a particular imaging center. And that's part of the equation.
That nobody can tell that patient where they can get that done. And so most patients will choose to get it done at a very high quality place where they can get in either the same day or the next day, not have to wait, and they know that highly trained subspecialized doctors who are some of the best in the region will be interpreting that study and getting a report back to their doctor within 24 hours.
But a lot of it is convenience to the patient. Does the patient want to go all the way across town to go to that imaging facility, or do they want to go to one that's in their neighborhood that they feel like they can trust? The law is very specific, which says it is the patient's choice. It's not the physician's choice, it is not the receptionist's choice, it's the patient's choice. So if the patient says, I've really heard a lot of good things about some facility, whether it's ours or not, they're in their full right to choose that facility.